The report from the think tank MEI found that the number of job vacancies among nurses tripled between 2018 and 2023. MEI's Vice President of Communication says training more nurses won't solve the problem. What's needed are better working conditions and flexibility. According to a survey by the Canadian Federation of Nurses Unions, 1 in 4 nurses shows signs of anxiety, depression, or burnout. And with me now is Doris Grinspun, CEO of the Registered Nurses Association of Ontario. Nice to see you, Doris.
Good to see you, Carolyn.
What do you make of the staggering number of nurses who are leaving the workforce at such a young age?
Yeah, first of all, let me tell you, this is not new. It only is being aggravated. The departures suggest that interventions must focus not only on recruitment, which we are doing very nicely, but equally and more importantly on retention, right? Keeping them from leaving, both across the country and also here in Ontario, but across the country. As you saw, the main findings are that nurses under the age of 35, the outflow from the profession relative to the inflow, meaning the number that leave vis-a-vis the numbers that come, has grown tremendously in the last few years. This is related to the pandemic, but not only, it's related also to the status of women. It's related to the fact that nurses are very well respected as a professional group, and they have many options in terms of careers, options in terms of where to practice, etc. We need to act in all fronts. On all fronts, we need to continue to recruit, but we need to focus more and more and more on retention, because retention actually is the best way to recruit also. If people continue to hear that people leave the profession, then it becomes harder to recruit. Although I must say the application to nursing schools, just so we are optimistic also, is higher than ever before. Okay, post-pandemic is the highest than ever before. We cannot uptake as many nurses as apply, even with excellent qualifications and average school, etc.
Well, that is an encouraging indication. We should note, because you mentioned the pandemic, that the data that was used to compile this report was cited from 2023 and 2024 from the Canadian Institute of Health. And that was the most recent data they had, but that did capture COVID years. So when you mentioned that the exodus could have been on account of the pandemic, do you think this accurately gauges how nurses are feeling across Canada today?
I think that Canada, and in particular Ontario, did many mistakes during the pandemic vis-a-vis the profession. As you know, in Ontario, we had the famous or infamous bill that capped the compensation increase at 1% at the time that nurses were, quite frankly, doing without vacation, doing without days off. They gave it all to patients. So that is a completely disservice to the profession. It's taking time, even though that's gone, it's taking time to recover about that. But always we have had an issue of early career transition that appears to be still a weak point, if not insufficient intervention on that. So at the beginning, people graduate, then they enter the profession, then they start to have a family, and that they start to rethink, do they want to stay in a profession that is very intense, very rewarding, at the same time very intense, and that's why we seem to be losing the nurses. So more and more programs need to intervene, not only at early career, which we are doing with many programs in Ontario. We are doing great with that. Needs to intervene at the vulnerable point that always has been age, I would say, 26, 28 to 35, the mid-career nurse. Because once a nurse then is established, after mid-career, they tend to stay, right? Sometimes they retire early at 55, but they tend to stay. So I'm not saying let's not pay attention to late career nurses, but the mid-career nurses still have a lot to give to Canada, a lot to give to Ontario. Let's focus with program specifics to them.
And that experience is so valuable. All right, thank you, Doris. Doris Grinspun is the CEO of the Registered Nurses Association of Ontario.